Because we have so many ribs, you can see that they come in different shapes and sizes depending on how high up we are. But the rib itself has some of the easiest features to learn. Starting down here, the piece that would be connected to your vertebrae, we have the head of the rib. Here's considered the neck of the rib. This raised bump is called a tubercle. Here's the angle of the rib. If you can see this groove here, that's your costal groove. And then finally, the body of the rib itself. Looking at the clavicle, sternum, and ribs, you can see how they kind of correspond with one another. And so here, if we start with the clavicle, the features on the clavicle include the acromial end, which corresponds to the acromion process in your scapula. Moving down, this sort of raised portion is the conoid tubercle. Here, the end that's next to the sternum is called the sternal end. Moving to the sternum itself, this piece at the top is called the manubrium. The manubrium. The middle, or the body, is called the gladiolus. And then here, this small piece is your xiphoid process. This is what you're trained to look out for when you're performing CPR. This sort of orange color is representing cartilage, the cartilage that connects your rib to your actual sternal process. The scapula may seem like it has a lot of confusing pieces, but once you orient the way it's supposed to be in the body and you recognize some of the root words, it becomes a little easier. So here, these features you can actually feel. Your acromion process, here's where your humerus would articulate in that socket. And so that socket is called the glenoid cavity. But starting back here to the acromion process and the spine, you can feel that on your back. Now here, in this area, this is a supra, so above, supraspinous fossa. Down here, infra, or below, infraspinous fossa. We're going to call this the suprascapular notch. The notch is extremely present in some scapula and hard to notice in others, but in this area, we're calling it the suprascapular notch. Moving down below the infraspinous fossa, here, this border, the one that's close to your vertebrae, the one that's most medial, is the medial border. Oppositely, we have the lateral border, or also called axillary because it's close to the armpit. So axillary border, medial border. Down here, we have the inferior angle. If we flip it over, again, here's the glenoid cavity. This is your coracoid process. Acromion process, coracoid process. This area is the subscapular fossa, the superior border, the superior angle, as opposed to inferior. And again, 5, we have the medial border and lateral border.